Hello, everyone, and thanks for joining us today at a presentation entitled Enterprise Virtual Care, Closing the Care Gap. My name is Chad Jones. I'm Chief Strategy Officer with Orb Health. We're a marquee and visionary sponsor here at the conference. Incredibly excited to be a part of this at the partner level that we are now, and excited to share with you today about how Enterprise Virtual Care has helped Health Choice Network and Community Health Centers of Pinellas actually close care gaps and increase ACO quality measures quite significantly over the last couple of years. We'll take you through how some of that works, a little bit about what Enterprise Virtual Care is, and then take you through how that had a significant impact on outcomes, both financial and patient. First of all, this is a second presentation that we've done since this is a virtual conference. You can go back and look at the first presentation that we did earlier in the week. That's entitled Enterprise Virtual Care, Bending the Cost Curve of Chronic Care and Beyond. So we talk a little bit about how chronic care management is affected by this type of transformational approach. But we'll cover a little bit of that here as well, and then go into how some of the care gap closures work. As I said, we are a visionary and a visionary sponsor of this session, but that's because we're also an exclusive partner with HCN for doing chronic care management, transition care management, patient support services. We're very excited about that agreement. We bring a lot of services to the Health Choice Network member clinics. Also, we know the Chicago Alliance is here watching these sessions. So, everything that you see here that we're talking about certainly can be applied to you as well. And there are some really significant outcomes I think you're going to be excited about when you see them. So let's go ahead and jump into this. Now, those of you who saw my previous presentation, a little bit of this might be redundant for you, but I think it's important to set the ground, set the table here as we go forward, because as healthcare, we're looking at some fundamental problems, and that includes a crisis in care capacity. And that directly affects patient access. And when patients can't access their services, and when we don't have enough people to reach out to be able to get to the patients, we can't close the care gaps, because it takes proactive engagement to make that happen. Across the spectrum, if we think about Medicare, we've got an explosive patient population that's growing, and unfortunately, there's still a ton of waste that's in the system. 52 million 65 plus US population. In 2018, it's going to be 95 million 65 plus US population by 2060. And that's a tremendous growth going on. There's about 10,000 people turning 65 every day. Well, health centers don't have the resources, and of course FQHCs and ACOs, they lack the resources, the employees, the budgets, and the knowledge to properly implement something that's truly scalable to meet all of the needs that's out there. When you're seeing a 6 to 8% reimbursement drop every 2 years, that's going to affect your ability to actually give care, and patients are going to lose access because of that. Providers have a shrinking doctor pool to pull from. It's overwhelmed, and that restricts access as well, even though the nurse pool is being greatly increased by about a 225% 10-year increase in nurse practitioners is projected. We've got to be able to get at those that talent and be able to capitalize on that, even as the doctor pool is actually shrinking. 2 out of 3 emergency department visits are actually headed off if a nurse just simply talks to you right away. I mean, that's a huge benefit when it comes to cost and keeping people healthy in their homes. We just got to make sure we can take those calls. And then patients have difficulty discovering, navigating, accessing, and engaging in the ever-changing myriad of care services. A typical health system, certainly one as robust as Health Choice Network, has all these things that keep bringing their patients. But if the patient can't navigate it, they're not going to be able to access it. So the key there is to have someone to help them do that. So originally we started with CHCP in chronic care management. Now, chronic care requires a bunch of budget, resources, staff to be able to make that work. Plus, it also requires care workflows, processes and protocols, billing and training and compliance services, all these things around a specific proactive reach out program. Most health systems aren't really built for that, right? They have their call centers, they have people that call in, but they're already overburdened. And a lot of times you call in, it takes a while to get a hold of somebody, you get a call back, those types of things. Not always, but it's definitely a burden. Now, if we're going to turn around and ramp chronic care into that, well, that's a significant program. Now, the reimbursements that come from that, tremendous. The other services, transition care management, remote patient monitoring, behavioral health, those things, tremendous. But I have to staff up for that. And already my budgets are shrinking tremendously, right? So we end up with a model that kind of looks like this on your screen, but we just don't have enough staff to really do it. And we've seen different health systems and clinics and health centers try this. And unfortunately, they get to about a 2% enrollment rate. It's been a year, they just haven't been successful. They end up closing their program. And that's a shame because there's so much potential there. So when we look at what is really needed, we need all of that extra staff to be able to expand care capacity. Well, where are we going to get that? It's out there, but it's more difficult for the actual health center. But that's where enterprise virtual care comes in. It's the ability to enable the scalable delivery of chronic care, patient support, and outbound clinical campaigns as a virtual extension of the health system without adding staff, apps, infrastructure, or budget. When we first started talking to CHC Pinellas about end of 2017, in 2017, and then signed our contract, first contract in 2017. We ended 2017. We found that there were, they really wanted to go after the chronic care opportunity, but they just weren't going to be able to get there fast enough on the budgets that they had. Plus, finding the staff was going to be difficult. So being able to step in and say, look, what if we were able, as an outsourced solution, to provide software and services that allows you to seamlessly extend that care to your patients, so they don't know that there's anybody else in between them and the actual health system. They just know that they're talking to their doctor's office and they're getting the care they need immediately. And that's the key of enterprise virtual care. It improves patient outcomes, it increases visits, expands care access, increases health system reimbursements. We'll see that in a little bit. It decreases emergency department utilization, hospitalizations that are associated with that. It accelerates and expands HCC scoring, which is really critical for quality, both from the ACO and from the Medicare standpoint. It improves value-based care quality and profitability, and it bends the overall cost curve of healthcare, not through subsidy, but through actually reducing the need to take very expensive services while the patient's still getting great care. They're just doing it from home. So if we look at the model that we had, where we have all of the services from the health system below, internal medicine, pediatrics, primary care, you name it, right? But now that's focused into the brick and mortar services delivered by inpatient, outpatient, and brick and mortar, or delivered by telehealth. But now there's a care coordination layer that comes over the top of that, and that's where Orb Health plays. So essentially, we tie in our virtual care cloud that talks to the EMR and bidirectionally syncs information with it. And then we set up all of the services, workflows, processes, and protocols needed to organize the patient information and present it to our Universal Patient Engagement Center. That's a set of certified admins, nurses, and physicians that can act as the front line to talk to the actual inpatient through any sort of communication means. Now, we use a care service contact number instead of email addresses and speak in the name of the health center. So, this is Nurse Jones calling from CHC Pinellas. Your doctor wants you to know that he sees it's time for your annual wellness visit. Well, they have no idea that it's anyone different. Orb Health to them doesn't exist. It's just an extension of that system. But they can get us 24/7. Now we have all the automated discovery, eligibility, enrollment, billing, training, and compliance services that wrap those systems, so we make sure everything is compliant, and then when it's handed off to the EMR, it's audit ready and ready to go. But you've spent years building your standards of care, the secret sauce that makes your care the best in the world. So we take those standards of care and we implement them with our care flow, with our own workflows. So that way we get everything we need to be able to deliver an outsource-based service, but it still has your touch on it. So that's very important. The components that make up an enterprise virtual care solution are fourfold. They're the virtual care cloud, the Universal Patient Engagement Center, the modular programs that they actually support, and the AI-driven patient intelligence. So the virtual care cloud is something that bolts on to the existing infrastructure. The EMR stays as the patient record of truth. The virtual care cloud syncs with that and organizes the information for our universal patient engagement center, but we don't have any new applications or infrastructure or anything like that that the patient or the provider has to worry about. You keep using your same EMR portal, keep using the same third-party additions to that portal for billing and compliance and all of those things. We just inform that and make it a better solution. All interactions are synced to that EMR record as well. And that informs our Universal Patient Engagement Center. And that gives us the ability to deliver scalable admin and clinical services in the name and institute of the practice. So if we need to scale our admins, our nurses, or our physicians, we can do that very quickly and easily at Orb. The actual health clinic doesn't even have to worry about that. We make that very, very easy. We do it as a just-in-time type of model. And then that enables a one-touch triage, scheduling, and escalation of patient issues as well. Since everything is synchronized to the EMR, we're actually able to have a very high level of collaboration with the brick and mortar and telehealth doctors and the virtual care specialists. So everyone's working together for the patients. But this idea of universal patient engagement means that if I'm able to see that, someone calls in and I'm dealing with an issue for them, well, I can still look at the record and I'll get an alert in our system, the virtual care person will, and they'll see, hey, this person's eligible for chronic care management. I should probably mention that to them. So we're always able to see the different issues that they have, and we're able to try to resolve those in that call once we have them. And that results in things like a lot more increased schedule utilization. We'll look at that, more average appointments. And that really allows you to transform the call center from a cost center to a profit center. And besides, 2 out of 3 ED visits are prevented by a nurse call. So from that simple fact alone, we see a tremendous amount of cost reduction. We'll look at what that means. The services that we provide: discovery, eligibility, enrollment in any of the programs that are supported, monthly care delivery, compliance oversight, care delivery coordination as well, being able to take everything that the patient needs, coordinating it for a schedule, their prescriptions, their labs, their specialists, all of those things, pulling them together, coordinating that care, making sure everything is compliant, the billing synchronizes back, and then we synchronize everything to that EMR. So again, an extension of that system. The programs we offer are patient support systems, things like scheduling and issue triage and immediate answers, proactive and reactive patient engagement, chronic care suite of CPT codes for Medicare. We also can support things in Medicaid, chronic care management, transition care management, principal care management, remote patient monitoring, behavioral health, and then outbound admin and clinical campaigns as well. Things like COVID, and we'll go through a use case like that here in a moment, lab results, emergency services. You have a hurricane coming into Florida. Do people have their medications and things like that to get through that? Annual wellness visits, all of those things can be done, as well. And you can pick and choose which programs make sense for you. As part of that, we do have an AI-based intelligence where we're able to take the information, put it through our AI engine for metadata, patient interactions, their prescriptions, and a lot more, and then determine what actually is best for that patient and continue to update those types of care, the standards of care, based on learning, non-intuitive correlations from, disparate data sets. And then we can learn from that and expand it to the whole and share that with our customers. Of course, we have data dashboards and visualization tools and things like that, so you can actually see what that looks like. An example of that, and this actually does help with care gaps too, is because we end up getting predictive about care. So we look at this is a real world example we had where we had a female who was 72 years old, had heart disease and diabetes, had a blood sugar spike, and complained of being thirsty, called in. We looked at that and said, hey, that could be an issue. Let's talk to the doctor, change the medication, track her condition every 2 hours, and we were able to lower the blood sugar very quickly, and that headed off an ED visit or hospitalization. A gentleman, 74 years old, had hypertension and diabetes, had a 2 to 3 plus edema bilateral lower extremities reported. We notified the doctor again, increased the meds, and that patient raised their extremities and lowered their sodium intake. We got them down, their edema decreased to about a +1 within 24 hours. And again, we headed off a visit. So as we learn that information, it goes back into the system and now creates this feedback loop where we start looking for those conditions, and it will start to alert more and more of our care pods and our virtual care delivery staff that this could be a problem across other patient populations. All of those things come together as, like I said before, a modular set of programs. There's a complete way to, or a way to completely put in your own bespoke workflows and protocols depending upon what you want to be able to do. And we see a tremendous amount of outcomes that are very positive. And then we also see their financial benefit that comes with that, as well as cost reduction. So the results that we're seeing at CHC Pinellas, I want to take you through some of those use cases. We started to see a 26% annual ACO patient savings because we were heading off so many of these different issues from going to the ED, getting into hospitalizations, keeping patients in their homes. And that was a very positive, very positive thing. But we also increased at the same time, about 22% our outpatient appointments. So, if you needed to see someone, we make sure that you were streamlined, and any immediate issue were dealt with on the front lines in the virtual care issue, and anybody else was actually escalated to telehealth or to an inpatient service. And we were able to increase the schedule utilization to 100% within 2 weeks of actually doing that. So with chronic care, that's huge, because if we can proactively see people that are starting to head down the path of exacerbation, we can head that off, right? So we also see about a 68% enrollment rate in our chronic care management programs. That just is shattering the industry average on top of that. But our enrollment can actually go for any type of program that needs enrollment. We can extend those services. Now, coding is a very big, big issue, because we need to make sure that all the codes are kept up to date, because that's how people get billed. Our KPIs go against that for quality scoring. So what we were able to find is that we actually achieved a 14% average coding increase, and that resulted in far better quality measures inside for the different patient populations. That amounted to about 11% annual HCCRF scoring improvement, and that that's huge for the ACO and also for Medicare. And then we also saw a 93% qualification rate in the chronic care management programs. So our automated discovery found that as we were updating coding and doing that, we had a huge qualification rate among patient populations, and then we were able to enroll 68% of those. So that's a huge patient population we're able to actually reach in the chronic care program. Now, as we continue down this path, and first when we were first talking to CHC Pinellas, we were already in one physicians group called the Texas House Call Physicians, smaller group. But we did a study with them, and over the first year, we found that we were able to produce a 64% decrease in ED visits. Took it down from 921 ED visits to 324. That was a tremendous amount of savings, about a 4.4 million estimated annual savings. So Pinellas saw that. We signed our contract December of 2017. We implemented the program, and then within the first year of the program, we had an independent group go back and perform a study. We found there that within the first 6 to 9 months, we had a 54% decrease in ED visits inside the chronic care community for CHC Pinellas, and that saved an estimated 6.2 million per 1,000 lives, and that's Medicare saving. That's a 54% decrease. That's tremendous, right? Saving a lot of money back into Medicare, but also that means people aren't going to the hospital. They aren't going into the emergency department, and that's of course critical as we're now in COVID land, right? The places you're going to get COVID are going to be the pharmacy, the doctor's office, the hospital, or the grocery store, right? And dealing with chronic care, you have the most at-risk patients are in these patient populations, so you want to be able to deal with their issues. Plus, they have medicines and prescriptions that they have to get done. Some of them have meal care programs. We can help coordinate all of that and keep them safe. The average ED utilization reduction as we had said, was 54% for orb, but the CMS average is 9% for a well-implemented program. We were able to do 54%. That's a 6x difference in being able to reduce that compared to CMS's best program averages. Very significant. But now, we looked at this enterprise virtual care model, being able to have scalable collaborative care capacity on demand, right? And do it maintaining those standards of care for your environment. But that's not where we have to stop. And this is where the point of our presentation comes in. CHC Pinellas looked at this and said, hey, these are tremendous results, but I have all this infrastructure ready to go. What else can I do with it? Well, patient support, is part of that. Outbound campaigns are part of that. So we introduced this concept to them. And of course, right around that time, a couple of things were really important. Number one, closing the care gap quality measures for the ACO was very important. So we implemented a program that was a proactive outreach to expand beyond the chronic care management program. It would help the results of the quality scores of the chronic care management program, but also for patient populations that are not in two or more simultaneous chronic conditions, it would help them as well. That we ended up with about 13 out of 13 preventative and wellness issues: diabetes 6 for 6, care coordination, patient safety 4 for 4, behavioral health 1 for 1, pulmonary 4 for 4. Pediatric is not really our coverage at this point. We were able to do 1 for 1 for HIV, patient experience, 2 out of 4 for utilization measures, and 1 out of 4 for other categories. That ended up being 33 out of 47, so a 70% care gap. Now, we're striving to go forward and work with CHC Pinellas to continue to get to 100%. However, 70% has shown tremendous results, tremendous outcomes, both for patients and in the financial side, as well. And we'll look at that here in a moment. For macro MIPS, we're able to cover a tremendous amount of those. We have about 6 health tracking mechanisms that cover the 5 required for the macro MIPS requirements. 19 for quality measures, that was for advancing care information, 19 for quality measures, and 31 for improvement activities. So again, we're already pushing to macro and MIPS, which is going to help with the quality scores, help with your patients, and help also at the end of the day with ACO reimbursements from their savings. But beyond that, when COVID hit, we had to look at that and say, look, we've got to get a way to deal with COVID. So testing in Florida was a big deal. And so in May, we expanded an actual COVID testing and results service. Now, prior to that, in February, we worked with the Chief Medical Officer for HCN and for CHCP, and we were able to create workflows and protocols and safety measures within 2 weeks and implement those to help our chronic care patients deal with COVID, understand what it is, how it affects them, make sure that they can stay in their home, get their medicines, food if they have food delivery, all of those things, so that we try to keep them as safe as possible. And then as we moved into May, we expanded that capability into COVID-19 consultations and then COVID-19 positive services. So a patient list would come from the CHCP website who were requesting consultations, or would look at that and reach out to schedule a telehealth or in-person visit depending upon the need. And then we would complete that registration process on that same call so the patient's ready to be seen. It's a one-touch resolution. Telehealth primarily would service that call. And then it would, if they needed a test, it would triage out and say, okay, yes, it sounds like you need a test. We would arrange to go get that test for those patients. Then if the test came back and, God forbid they were actually positive, again, there were surges going on in Florida, then we would reach out to the patient, with the results and, tell them, hey, it looks like you have a presumed positive. We need you to come in, and we would schedule the appointment, conduct that registration, and then we would answer subsequent questions on what, this means, what they should be doing, and then make sure that they attended their appointment or televisit. The stats on the bottom are from that response program. About 1,672 registrations completed. We were eventually able to get a 58% appointment conversion on top of that. And again, we implemented this program very quickly. Now, the program lasted about 6 weeks because Florida ended up stopping testing and there was no more funding to actually do testing. So our program ended up being put on hold after that. But we still saw a tremendous amount of success in closing the care gap in dealing with COVID-19, right? And then the other program we're implementing is annual wellness. So we want to make sure that patients come in for their annual wellness visits. So there's a proactive outreach program going on. Our platform looks at all of the, or cloud looks at all of the patients, sees who's eligible for that, organizes that for our call center, and then our Universal Patient Engagement Center reaches out to them and makes sure they gets them in. And again, we're averaging about 2.8 or more additional appointments per year out of this patient population, out of these patient populations. To ensure that their wellness is done proactively and we keep them out of more expensive services. So from a dollar figure, if we roll all of that up and we look at CHC Pinellas, and we're looking at the ACO and across multiple risk contracts, right? Before enterprise virtual care in the ACO, it's about 11.4 million in spend, 8.4 million post enterprise virtual care for a savings of 2.9 million annually. Across the different risk contracts, we see significant savings. At the end of the day, that ends up being roughly, total $6 million in cost savings annually across the contracts in ACO. It's a tremendous amount of savings. But on the other side of that, revenue is important as well, because obviously reimbursements have been shrinking for a long time. But now we can end up bring more of those to bear, especially coming out of COVID, and start to recoup some of that money that's been lost because we had to shut down everything else but COVID response. So increase in revenue, the call center utilization increase, and you can see that across the ACO and the risk contracts. Implementing behavioral health and chronic care management as a fee for service. And then transition care management as well. Someone exacerbates, go to the hospital. We need to make sure that we set an appointment for a follow-up. That's transition care. That's another CPT code that's reimbursed. We're able to handle that. So the annual revenue increase that you're seeing across the board is about 20 million. So from an ROI perspective, you actually have an upswing of over $26 million annually that's projected for CHC Pinellas, and we're actually on track, to do that. That's a tremendous ROI, and we're doing it in a very short amount of time. Elodie Dorso is the CEO of CHCP and a tremendous partner for us. We couldn't be happier to be working with her. Quote from her, like many federally qualified health centers, CHCP is always looking for ways to implement innovative solutions to decrease the cost of care while also improving the patient experience, especially for those with chronic disease. This dramatic reduction in costly ED and hospital readmissions after only 1 year is encouraging for not only CHCP and our patients, but Florida's entire FQHC community. We couldn't agree more. Working together and continuing to extend this across the HCN network and across the other members of the ACO, and also out into the Chicago Alliance memberships, we think that we're going to transform healthcare and how it is done today. With unprecedented, we actually provide unprecedented economies of scale and provide patients with coordinated care access that leverages all providers, resulting in a significantly reduced cost curve. That's what Enterprise Virtual Care is providing. It's value across the board. Patients get immediate triage and expand their access, and it reduces their need to go to the ED, which no one wants to do. Providers are leveraging, their PAs, RNs, ARPNs as scalable providers, because we can use that inside of Orb Health, inside of our call centers. And then we focus the doctors on handling patients that they need to see in person. Health centers can scale care capacity on demand without additional resources or FTEs or apps, anything that they have to learn, right? Because the EMR is the center of that. We make that very simple, and that lowers the cost curve of healthcare. Truly, it doesn't subsidize it, it truly lowers it. Then Medicare sees a scalable model to handle the exploding patient population that increases outcome and their savings, right? All of this works hand in glove to be a transformational entity in healthcare that, again, helps our patients while helping our bottom line as well. All of this leads to maximizing value-based care opportunities in front of us, moving from a fee-for-service model to a value-based care reimbursement model, to finally optimizing that through shared savings and MIPS and scoring and more. But altogether, we look at implementation times that are anywhere from 6 to 8 weeks. And all of these benefits begin right at patient one. As soon as we do that, you have an ACO, we can help you with that. You have a healthcare clinic or a health system, we can help with this value immediately and close those care gaps so that everyone gets healthier, and that includes the bottom line. So there is a chat that is a live chat, even though this is recorded. We will be watching that to answer any of your questions. So please feel free to chat away at us. Come and check out our virtual booth, which is still a strange concept, but we are in strange times. But come and check that out. We have a lot of information, and we can live chat with you, schedule appointments to talk about your particular challenges and how the success that we saw at CHC Pinellas, and with HCN can apply to your clinic, to your FQHC, your ACO, your health system, if you're part of Chicago Alliance. We have www.orbhealth.com for information there. If you go to our outcomes page, you'll see a lot of things there on our resources side, has a lot of white papers and infographics that can help you as well. Again, my name is Chad Jones. I'm Chief Strategy Officer with Orb Health. I want to thank you for taking the time to be with us today at this virtual conference. And I look forward to meeting you in person one day once we beat this virus and we get to come back together. Until then, be safe, be well.